Barboza, and I will be doing a head-to-toe assessment. This is Jonathan, who has given consent to be in this video. So I'm going to knock when I enter the room, perform hand hygiene. I'm going to ensure that there's privacy, that there's adequate lighting for this assessment. I'm also going to observe my patient for his posture, for color of his skin. I'm also going to observe for any odor if I smell anything. His hygiene, his clothing is appropriate for the weather outside. So my name is Vivian. I will be doing a head-to-toe assessment. My priority for today is for you to not have any pain or discomfort. So if at any time you do have pain, please let me know and I will stop. Okay. Your vital signs have been taken by my assistant. Heart rate, blood pressure, temperature, O2 sat was all within normal limits. They also checked your height and they weighed you on the scale, which was appropriate for your age as well. And nutritional status was also checked, which was appropriate for you. First, I'm going to do an assessment, a neurological assessment of all your cranial nerves. So I'll go ahead and explain what I'm checking as I go, okay? They did the Snellen test before you came in, which showed you had 20/20 vision. Next, I'm just going to look into your pupils. You can go ahead and look straight, and I will be flashing a light into your eyes, okay? Okay, and one more time. All right, and then I'm going to ask you to follow my pen without moving your head. Just follow with your eyes, okay? Okay. Now, I want you to look at my pen, and now if you can please look at the clock behind me. Good. So, pupils are reactive to both direct and consensual lighting. Convergence and accommodation were both present, so cranial nerves 2, 3, 4, and 6 are all intact. Next, I'm going to just palpate around your mastoid. Are you having any pain? Okay, go ahead and clench your teeth for me. Good. Smile, show me teeth. Good. Frown. Go ahead and puff out your cheeks for me. Good. Go ahead and close your eyes tight, tight, tight. Good. Relax. Keep them closed. I'm just going to assess that you can feel me touching. So I will be touching your face. Let me know when you feel it. Yes. Yes. Good. So cranial nerves 5 and 7 are intact. Next, I'm going to be doing a hearing test, okay? It's going to be 2 different tests. The first one is the Weber test. I will be placing it above your, on your head, and you will tell me if you hear it louder in one ear or if it's equal, okay? Both, good. Now I'm going to place it here on your mastoid, which I palpated earlier, on both sides. That's checking bone conduction, and when you tell me, you're going to tell me when you stop hearing it, and then I will move it to in front of your ear, and then again you will tell me when you stop hearing it, okay? No. 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 Okay. Good, so cranial nerve 8 is intact. Next, I'm going to ask you to stick out your tongue for me. Good, side to side. Good, now say, or open your mouth for me and say, ah. Good, and swallow. And we did a gag reflex test as well. So cranial nerves 9, 10, and 12 are intact. And last one, I'm going to ask you to shrug your shoulders up against me. Good. And move your head towards the side of my hand. Good. Now this side. Good. So cranial nerve 11 is intact. Okay? Next, I'm going to do hair, skin, and nails. So hair is even. There's no thinning. I'm just going to look at your skin. Good. So cap refill is less than 3 seconds. There's no nail clubbing. While I'm here, I'm just going to assess for your pulse. Good, so radial pulse is palpable and strong. Next, I'm going to palpate your head, and then I'll be palpating down your neck as well. And then I will also check your sinuses on your face, okay? And right now, I'm just looking for any lesions, any masses that I feel, which there's nothing. Are you having any pain? No. Good. Like I said, your sinuses, so your frontal, your ethmoid, and your maxillary sinuses. Any pain at all? Good. Next, I'm going to just check the color of your eyes. So I'm going to pull down on your lid as well, okay? So sclera is white and conjunctiva is pink and palpable. Next, I'm going to look into your nose. So I want you to put your head as far back as you can. That's good. I'm just going to flash a light, okay? No deviation, nothing blocking. Next, I'm going to ask you to open your mouth again. You don't have to say, oh, I'm just looking for any sores or lesions. Good. Next, I'm going to palpate your ear, both your ears. I'm just palpating the pinna, tragus. Any pain? Good. Now I'm just going to take a look with my light, okay? And so I'm going to pull it up and back. And tympanic membrane is gray and pearly. I'm going to do it on the other side as well, so up and back, okay? Good. So it's gray and pearly on both sides. Next, I'm going to move down to your chest area. I'm going to inspect for any asymmetry. Next, I'm going to go ahead and listen with my stethoscope, okay? So I'll do both respiratory and cardio while I'm here. So respiratory, I'm going to listen to your lungs first, and then I'll explain when I'm listening to your chest, okay? To your heart. So I will be showing, for the purpose of this video, I will just show what points I would listen to, and I would be listening for a full inspiration and expiration of his lungs. Okay, next I will be listening to your heart. So I'm going to listen to the aortic valve, which is on the right sternal border, second intercostal space. Then I will listen to the second intercostal space on the left sternal border for pulmonic. Then I will go down, still on that same left sternal border, to the third intercostal space, and I will go to the Erb's point. Then I will go down to the fourth intercostal space and go to tricuspid, and then to the fifth intercostal space for mitral valve. And I will also listen to these with the bell in the same exact spots that I did. And while I'm here, I will also be looking, or I'm assessing for your PMI, which is the point of maximal impulse, which just basically means I could feel your heart beating. So I will go mid-clavicular and down to about the fifth intercostal space, which I can feel. While I'm here, I will also listen to the carotid artery up here with my bell, and I'm listening for any bruits on both sides, which I do not hear. Okay, next I'm going to ask you to face that way, and I will be listening to your lungs again on the back side. Before I start listening, I will inspect for any asymmetry, which I do not see, and I will be listening to the back posterior approach, but there's 8 spots in the back for a full inspiration and expiration to assess both sides of the lungs, which seemed equal both sides bilaterally. While I'm here, you're just going to feel my hands on your back, and I'm checking for tactile fremitus. So if you can please say the words 99 every time I place my hands on your back, okay?
99, 99, 99.
Good. Now I'm going to wrap my arms around your ribs, and I'm going to ask you to do a full inspiration and expiration. So inhale big and then exhale, and I'm just checking for respiratory excursion, okay? Good. So movement was about 4 centimeters, which is normal. Now I'm going to check your diaphragmatic excursion. So I'm going to ask you to take a full deep breath and then exhale and hold. Okay, hold it. And you're just going to feel me putting a little tapping pressure, and I'm just looking for dull. Okay, I found it, so go ahead and breathe. Now I'm going to ask you to take a full deep breath again and hold it in. Okay, relax. So diaphragmatic excursion was about 4 centimeters, which is also normal, okay? Okay, go ahead and turn back around this way. I'm going to ask you to lie down. Okay, so now I'm going to just check your abdomen area, okay? I'm just inspecting first for any lesions, scars, which I don't see. Now I'm going to auscultate, and I'm just checking for some abdomen sounds in all 4 quadrants. Typically, I would listen to each quadrant for at least a minute that I heard sounds, which I hear normal active in all 4 quadrants. While I'm here, I'm going to listen with the bell for the aortic. Then I'm going to go down here for the renal on each side, and then iliac, and then it would be deferred, but I would do the femoral as well. And now I'm going to do just some light palpation, some pressure in each quadrant of the abdomen, and I'm looking for any masses. Do you have any pain?
No.
Good. So everything seems good there. Now I'm going to ask you to lay down still, and I'm just going to do some range of motion on your lower extremities, okay? So I'm going to ask you to raise this leg all the way up. Good. Now bend this knee. Good. All the way back. Great. Rest that one. And we're going to do the same to this side. And bend your knee all the way back. Good. Any pain in your hip joints?
No.
What about your knees? Good. Ankles? No. Can you twist your ankles in circular motions for me? Good. Wiggle your toes. Perfect. Now that I'm here, I'm going to assess for pulses. So I'm just checking your dorsalis pedis pulse, which are palpable and strong. And then I'm also checking your posterior tibialis as well, which are palpable and strong. You can go ahead and sit up now. While I have you here, I'm just going to check that you can feel the vibration of this. I'm going to check these 2 pulses, your Bode's prominences here, and then I will check it on your great toe as well. Okay? Do you feel it?
Yes.
Good.
Yes.
Good. I have you sitting there, so I'm going to check your reflexes now, okay? Go ahead and relax. Make sure your legs are hanging. There you go. Good. And here. Strong one. Okay, if you can now lift this leg on, or put this ankle onto this. Set it on the knee. It's okay. Can you have it hanging off? I'm going to try and check your Achilles reflex on this one. Okay, and then we'll do the other side. Good. Okay. Now I'm going to check your reflexes on your hands. So go ahead and relax your arm for me. Good. Good. Now I'm going to check your brachial reflex. Good. And we're going to go to this side. Good. And then I'm going to raise your arm to go this way. Okay. Relax it. Good. And then I'll do the other side as well. Good. Now that I have you here, I'm going to have you raise your arms over your head like you're making a circle. Good. And I'm going to try and break your... Good. Now go open them. Good. Okay, set them down. Go ahead and move your elbows up and down. Good. Any pain when you do this? Good. Put your arms back up and try and pull against me. Good. Now push against mine. Good. Go ahead and move your wrists. Good. Any pain with that? Good. Now I'm going to ask you to do heel to shin. So if you can do this heel, slide it down across that shin. And other side. Good. And before I have you stand up, I'm going to just check for point sensation. So if you feel this, it's a dull, and if you feel this, it's sharp. Okay? So go ahead and close your eyes.
Sharp.
Again?
Yeah, dull.
Now?
Dull, sharp.
Mm-hmm.
Dull.
And here?
Sharp.
Okay, a couple more, okay?
Sharp. Dull. Sharp. Dull.
Good. Lastly, you can go ahead and open your eyes. Lastly, I'm going to ask you to stand up. We'll do a couple walks, and then we'll be done here, okay? So go ahead and walk to the chair just normally. Good. Go ahead and walk back on your heels.
No, my heels like this.
On your heels, just like this. Sorry, I can show you. Good. Now on your tippy toes, walk back. Good. And then bend on over and walk towards me. A duck walk, as we call it. Perfect. That's great. And then if you can just face that way. Bend over. I'm just going to check your spine. Good. Any pain? No. Good. Do you have any questions for me?
No.
And that concludes our head-to-toe assessment.
Thank you.
Thank you.